You are listening to the
World Extreme.
World Extreme Medicine.
The World Extreme Medicine
Podcast.
Welcome, everyone, to the World Extreme Medicine Podcast. I'm Dr. Sarah Spelsberg, and today I'm thrilled to have Dr. Robert Knopp join us. Not only is Dr. Knopp an experienced emergency medicine physician, but he's also an avid kayaker with a passion for wilderness medicine. Drawing from years of experience in both the medical field and outdoor adventures, he brings a unique and personal perspective on managing shoulder dislocations in the wild. So whether you're a kayaker, paddler, a medical professional, or someone who just loves being in the great outdoors, you won't want to miss these invaluable insights and stories that Dr. Knopp is going to share with us. So welcome, Dr. Knopp. Thank you very much for joining us today.
Thanks, Sarah. It's great to see you.
Nice to see you too.
Yeah, it's a little chilly here in North Carolina right now.
It's
I appreciate
snowing.
all of the praise.
It's much deserved, much deserved. I could have gone on and on. But I'm thank you very much for your time and thanks for sharing this with us. I actually cornered you and you and I were talking about this and I said, I need you to come on the podcast and say these things. So I really do appreciate it. So let's dive in. So first, with any sort of medical advice online, we have to do a disclaimer, really, because obviously if someone dislocates their shoulder and they can get to a hospital expeditiously and have it treated appropriately by medical professionals, that's our official recommendation, right?
Yeah, I think always. I mean, this is a painful thing. You would much rather have it done in an emergency room with experienced individuals and pain control on board.
100%. That makes sense. And that's best and safest. So officially, everyone, our official recommendation is please go get this treated appropriately by medical professionals. But that's best and safest. But Robert, you and I were discussing a few simple maneuvers that people could try in the field if their extrication was going to be prolonged.
Yeah.
And we made some videos in a PowerPoint to share with you all. So I'm going to pull that up now. So we're sharing our screen. So these are just like a couple of field shoulder dislocation reduction techniques that Robert showed me in the field that we're going to share with you all today. And if we need to, we can always play the video twice.
So this is Davos.
Yes.
This, essentially performed by yourself.
Yes. So if somebody's in the field by themselves, they could use this to possibly self-relocate.
So, you're essentially, interlocking your fingers, and you kind of bring your knee up, and you're applying leverage while you're leaning back and basically pushing really hard, forward, kind of across your tibia there. And with the idea that hopefully that reduces an anterior dislocation. There's also some, examples out there where you actually put some tape around the wrist. But I think ideally this is probably the best option if you're by yourself and you don't have any assistance.
And I've heard that this is a technique that's actually taught to Navy SEALs for faster boat exits in case this ever happens.
Yeah, I think so. Yeah.
That one's reasonable enough, easy to do. And about how long would they have to stay in this position, do you think?
Well, I think it probably depends upon how well you can tolerate the pain. I mean, theoretically, you're going to get some muscle relaxation the longer you stay in that position. But, if you're a strong person, you have a high pain tolerance, you may be able, to theoretically reduce that in just a few seconds if you're aggressive. But the relaxation component has some advantages in reducing muscle tears and, ligament tear.
Nice. And this is when we think we have an anterior dislocation.
Mm-hmm.
All right. And now let's explain to me what we're doing here.
Oh, so this is, modified kind of situation. You're basically being creative about positioning. Let's say that first maneuver didn't work, and you kind of want to set up something that has a little more leverage. And obviously you're not going to be trying to move, whichever shoulder is injured at this point. So, create some mechanical advantage is the goal here.
And I saw how you tied that knot pretty effectively with one hand. I saw you doing that on purpose.
Yeah, I think most kayakers probably, spend quite a bit of time, tying knots and practicing rope work. So I think it's a reasonable thing to be able to do. And there's a lot of overlap too. A lot of kayakers are also rock climbers. So
Sure.
most folks out there probably have, and these aren't complicated knots by any means,
No, for sure. And so you tie that knot and you kind of make a way that you can.
Yeah, so just basically making like almost a 3-to-1. And then, using this point here essentially to connect to the life jacket and kind of run it back through. So you've got some leverage with so the side where the blue bit of cordage is, it's going to be a little shorter so that as you're leaning back, it kind of pulls forward. And you could even theoretically put that loop around your wrist so that, you're not holding on to it.
Yeah. And then this is so your right arm is the injured arm in this scenario, and you're using your good arm to like connect this to your life jacket. That's great.
Yeah.
I love it. That's a very clever maneuver, and that would work for an anterior shoulder dislocation also.
Yeah, I think it would. You might have to do some positioning with like height, whether you're, you need to be standing up a little more to do that and get your fixed point where that tree was, maybe a little lower or vice versa. You're gonna have to try some angling, but yeah, I think it would be effective.
And you were able to put it together with one hand. And so now this is some rock climbing gear I recognize. And so now what are we doing here?
Yeah, so these are some nuts. I typically, if I'm going to be really far out, carry 2 or 3 of these in my kayak. They're pretty handy to have. I don't think I've ever used one, in a setting to reduce a shoulder, but I've definitely used this to, get a boat that's, pinned out. So it's kind of a handy thing to have tossed into your emergency kit.
Absolutely. I wonder how many kayakers have these in their kayak. I bet they will now.
I actually got this idea from one of my buddies that's a real avid rock climber.
Uh-huh.
Few people
I mean,
out
if you
there
think,
do
and
that.
if you're trying to like pull up to shore and it's a really rocky shore and you just want to like stop for a second and be anchored, like you could actually do this, anchor your boat, and then do the Davos technique. The first one we showed people.
Yeah, sure enough.
I love it. I love it. And then this is another technique that we actually sometimes use in the ER.
Yeah, super effective. Just letting gravity do the work. So this
and so
is
basically,
Stimpson's.
Stinson's maneuver, you said?
Yeah. So, I mean, you could do this with a bag like this, put some rocks in it. I mean, you could probably even fill it up with water. That might be heavy enough, depending upon how muscular the individual is.
That's the same thing in the ER. Sometimes we have to work a little harder, especially the more muscular people are.
Yeah. Especially, in that setting, if somebody, has a reason that you can't sedate them. Obviously in the wilderness, that's not an option. So
no, and that's great. So if they could just find someplace with a drop off and they could hang the arm over and hold on to something heavy, that would be another way someone could relocate. That's very cool. Thank you so much. Can you share an experience where you have had to manage a shoulder dislocation in the field, particularly during a kayak trip or any other time? And how did you all approach it?
It's probably the most common kayaking injury that happens to individuals, unfortunately, and a lot of that is probably technique induced. Yeah, I had a friend, it's been back a couple years ago now. I wouldn't really say he was like a newer kayaker, but he advanced really quick. He went from, paddling class 2 and 3 up to paddling class 5. maybe in 6 months or a year. So, pretty quick progression. And he had a dislocation on the Russell Fork. And it just so happened it's a pretty steep ravine. It's a pretty hard hike out. And he was in a lot of pain and a really muscular guy. So we wound up, kind of just talking to him. It's like, I mean, we could try this here. I can't guarantee you that we're going to be able to do it because, like I said, really, really muscular guy. He's, I don't know, probably my height and like 220 or so. But so we actually had him, kind of basically lay on a rock. And I was down in the water, and we got some external rotation. I was able to kind of pull that way and get it reduced. So overall went pretty well. Not the most ideal location, but I felt like it was safe enough. It wasn't in the middle of a rapid. It was in a pool below the rapid that he had flipped over in and got the edge of his paddle caught. And I think instead of letting go, he held on to try to keep it like most paddlers would. It's kind of your lifeline. It's hard to get down the river without a paddle. So he held on and unfortunately kind of suffered the consequence of that.
Yeah. So he was able to get out and onto this rock, and then he hung over the edge of the rock, and you kind of acted like the weight, but also
Yeah,
using the
exactly.
mechanics that we've learned how to do. That is great.
Yeah.
That is so cool. That is so cool.
Yeah, so it worked out pretty well overall. Long term, I think he had to wound up having a labral repair.
Yeah.
But at the time, given the options, it was probably the best choice.
Yeah, I feel like you kind of had to do that to get out. Was he able to kayak down then with the injured arm, just gently
Yeah,
as
so we
possible?
talked about that too afterwards. It's like, well, walking out is not
That's
the
terrible.
greatest option.
Yeah.
Whether your shoulder's dislocated or not dislocated. So
And
yeah,
you're
he
leaving your
actually wound
boats.
up. Yeah, exactly. Yeah, he actually wound up paddling out, and the rest of that run is like a few class 3 rapids after
Okay.
that, but manageable.
Yeah.
I broke my wrist on that same river just a couple 100 yards upstream, and I was able to kayak out from there.
Oh no. Did you hit a rock? Like what happened?
Yeah, I was boothing off of a big drop they call the box, and I smashed into a rock that's right below there. They call it braille for good reason because when you hit it, you feel it, and I felt a little more of it, I guess, than I did too.
Oh, that's terrible. I mean, there's a reason why the shoulder dislocation is called kayaker's shoulder. It's just very common in that population. And it happens in rock climbers and everybody too. Like, what would describe some of the common like mechanisms for shoulder dislocation among kayakers and other sports if you want?
Sure. So we talk about like, when you're working with people, new folks, and you're getting them on the water the first time, we talk about like staying in the box. Let me see if I can get myself in view here. But, basically, like you want like elbows kind of tucked in a little bit. And there's some great YouTube videos out there to kind of explain some of this. But as you're like taking strokes, like you're not doing it like all arms, which you see a lot of people do when they're like lazy paddling, on the lake. It's much more of a core motion, and you basically try to keep your arms straight and you're rotating at your waist and moving through.
Okay.
Yeah. But yeah, some really good videos out there. I always tell people to like look up like Dane Jackson or Eric Jackson. Some of those got some good videos, both of them out there about, different paddling techniques. Yeah, people I think get into trouble when they're not kind of maintaining that, that kind of rigidity up top, and they're just using their arms to reach forward, so when you reach forward and try to like take a stroke like that, you got to think like this comes up, you're already kind of like changing the angle. And then a
Mhm.
lot of times what happens is people wind up like with elbow above the shoulder and then wrist is above the head. And all it takes, is a wave to kind of catch your paddle edge. And, you flip upside down in a whitewater kayak. It's designed to do that. And you flip back up. But in that position, if you flip upside down, you've got that edge caught. It's a lot of force on this,
Mhm.
pulling back and away.
Mhm.
It doesn't take that much to get an anterior dislocation in that
No.
position.
Yeah, and they're kind of like bracing sometimes and trying to like, yeah, I could see how
Yeah.
that would happen.
Yeah, and that's the other thing we talk about, is like high brace and low brace. So and again, a lot of these injuries happen when people are high bracing. So you know, hands are up, your blades kind of like this, wrists are rocked back, and you're kind of digging into the water.
Mhm.
People a lot of times will try to dig into the water like this and they put their arms up high. Like really what you want to do is like you want to lean your body into that, keep your wrists low, kind of at shoulder
Mhm.
level and dig in. Or even low brace, where you flip your wrists forward and you're kind of leaned up over, kind of center of gravity, and your elbows are tucked and you're kind of slamming the paddle like into that wave.
Okay. It's easy. I mean, it's easy when especially when you're pushing your boundaries, as most athletes like to do. They like to say,
Yeah.
"Oh, I've conquered," climbing. I was always like, "Oh, I conquered this. Now I want to do this. Now I don't want to do, I did a 9. Now I want to do a 10. Now I want to do
Yeah.
11." And
100%.
so you're always pushing your boundaries. And so I think as a kayaker, like it would be very easy to get yourself into the weeds periodically and like you said, lose your form. And what were the names of those guys? People should Are they on YouTube?
Yeah, they both got pretty good followings. Most people in the kayaking world, Dane Jackson's pretty famous. He's probably number one in the world currently. And then his dad, EJ, Eric Jackson,
Okay.
has got a
So
lot of,
EJ and
yeah.
Dane Jackson.
Hmm.
Okay.
Yeah.
All right. That's great. And so advice for kayakers, I mean, stay in the box.
Yeah, stay in the box, stay mobile, stretch,
Yeah.
keep those elbows low. I think it's important. Let's go with somebody that's more experienced till you kind of get to the next stage and let other people tell you when you're ready, somebody that has your best interest in mind.
Hmm.
And that I think the thing that kayakers don't really think about as much when they start out in the sport, is there's 5 grades, but like class 5 includes like hard whitewater, but it also includes, 150-foot waterfalls. And we don't really
Yeah.
have classifications in between. It's all class 5. Nobody's really kind of changed the difficulty scale. And everything below that, like class 4 is hard and has danger and has risk. Without a doubt, and people get injured in those settings too. But I think, as people kind of progress, and they're stepping up, they don't realize like how much of a change sometimes, like, even class 3 to class 4 is a huge skill level change.
It's it is. It is and it's a huge deal. And I'll never forget. We were actually rafting a river and there were kayakers too. And there was one section of it that was a 5. And when we came, oddly enough, I was with my search and rescue team out in Colorado, the San Miguel County Search and Rescue Team. And when we came across someone had gotten flipped out of their boat and into a place called the Room of Doom.
Oh,
And it's where like the rock splits. You want to stay as far left as possible when you're there, but if you get sucked into that, it just goes around and around and around and it pulls you
yeah.
down. It's this awful whirlpool and you won't come up for 3 to 5 days. And so my bosses actually kind of parked us and they, started trying to do a rescue mission and but we weren't able to find him. They found him a couple days later and it was so sad. And
It is
it's
sad.
it's just very easy for things to get out of control. Like water's a very powerful force. And
Yeah, 100%. I mean, it's a sad thing. I haven't lost anybody that's been a super close friend, but I've had some like acquaintances that I knew kind of peripherally, in the past probably 5 years that have passed away. A couple of young kids actually that I paddled with kind of late one fall. I think they went down. Can't remember whether they were in Colombia or Ecuador. They were somewhere in South America. It, Gauges aren't great down there. You don't, you're kind of showing up and either with somebody that kind of knows the river or you're just kind of putting on and you're looking at it. And, it's much more of like an expedition style paddling experience. And I think they just had an unexpected like rise and flow. And unfortunately, I think all three of them drowned. It's a very sad case because they were all young guys, like in their early 20s, kind of late teens. But yeah, those kind of things suck in the whitewater community. But yeah, it seems to happen, unfortunately, to us, every few years.
My friend Jeff Durande is like the most outdoorsy outdoorsman I knew. And he's the one that I put in all of my slides presentations. But he yeah, it was glacier runoff and it had been a really intense year and I mean, and this man, like whatever crazy thing he said he was going to try to do, like he did it. Like he did it. He traversed the crevasse and got to the top of the volcano. Like he wakeboarded in the Bering Sea, behind behind a boat, like whatever it was, like he just did it and there was nothing he couldn't do. So when I got that call that he had gotten kind of flipped out of his boat and he was missing, like it was the most surreal experience because like how does that guy drown? What, like. And it was just, I mean, we miss him so much every day. So I bring him up every chance I get just to celebrate him because he's a badass and he would not want anyone to stop. He would say, go do it, go for it. That was a fluke. Like he would say, get out there and adventure. But we all miss him very much. And so so let's say you're kayaking with somebody and their shoulder's dislocated. Like what are some key signs that might be easy for lay people or symptoms that people should look for to confirm the dislocation, to tell whether or not there's a fracture?
Yeah, so I mean, obviously, the first thing's going to be it's going to hurt a lot. I have heard of maybe one or two folks, like after they've dislocated their shoulder, being able to roll their kayak back up. And I mean, I think it's pretty rare to be able to do because you're going to lose, virtually all of that mobility to be able to extend and kind of, rotate. So I think that's good indication. And then, you're looking for gapping here in between the humerus and your acromioclavicular joint.
And it looks like it almost like steps off, like it's
and on somebody that's not like bodybuilder habitus, you can probably feel the front of their humerus, the proximal head, kind of anterior, a little kind of over into medial. Especially if you're comparing it to the other shoulder. And what I think, get clothes off, dry suit off if you can, get a good look at it. Try to do a little bit of range of motion, feel for grinding. If a bone is grinding, dislocation is probably not your biggest concern, and I probably wouldn't go and try to pull on that to put it back in place, even if it were dislocated, because it's not going to work. And then I think other things to worry about and think about are, any kind of peripheral nerve symptoms in the hand, check for a pulse. I think those are all important things. And that again, like would give me a lot of pause. Like, do I do I really want to try to reduce this person's shoulder? If there's any kind of chance, if we're within, a couple of hours of getting them to the hospital, probably better to wait. If you're 2 or 3 days, well, you make a hard call, I guess. But
and that kind of brings me into my next question, which was like, I think, if they can grip your hand and give you thumbs up, like you're pretty happy about their sensations intact, they can feel you touching them, you can be pretty confident that their nerves are okay. But what are the risks of attempting a shoulder reduction in the field? And I know we just touched on it, like time, like how do you weigh the benefits versus the potential complications?
yeah, I think ultimately, like, yeah, benefits and risks in this situation, it's like exposure, right? Like that's really what it comes down to. Like, are you equipped to spend the night in the wilderness, or not? Like, and benefits and risks of reducing the shoulder in that setting. Like, do you cause a peripheral nerve injury? Theoretically, you could cause a vascular injury. I think that's quite a bit lower risk, but you certainly could. And there's always risk anytime, you reduce the shoulder, that you're going to have, muscle tear, labral injury. The shoulder's mostly cartilage, ligaments, and muscle anyway. Your glenoid is essentially flat and your humerus just kind of sits right there on it. There's not a lot of, it's not a real joint like we think about other joints being.
And they can fracture on their way out. There's a couple different types of fracture that they can have, and that can make it more difficult to get it back in. And, it gets injured on the way out, and we try really hard not to injure it on the way back in.
Yeah.
But it's hard.
Yeah, so I think from like neurovascular standpoint, like I think those are the things that you think about and worry about. And then, like I said, I think exposure, like how easy is it going to be to get this person out, with a dislocated shoulder versus not, are they going to be able to tolerate it being dislocated out? Because it's incredibly painful, especially for the person that's the first time they ever dislocated it,
Oh, absolutely. The first time dislocators, they're harder to get back in too.
Yeah. And the longer you wait, the harder it is to get back in. So, and I think that's, the guy we were talking about earlier, that was kind of the choice we made, based upon his pain level, and difficulty of him trying to hike out either one with one arm, or, you can't paddle with one arm. It's virtually impossible.
I feel like you had to try.
Yeah, I think so too. I think in hindsight, I might have taped that shoulder once we reduced it and put kind of a, makeshift brace around like here to give it a little bit of support, like across the chest and back. But at the time, I didn't think about it. And he didn't really have like we just didn't have a lot of the supplies like that.
You're trying to be light
now more often these days,
like physio tape or athletic tape.
Yeah, that would work. So I carry a lot of like the athletic tape, like the climbers tape. It's really good for like, kind of minor like hand injuries, you scuff up a knuckle, or if it's really cold and you're paddling a couple of days and you get like, some cracks in the skin or the fingers and super glue is not working, like tape it up. It works really well. So and it does an okay job sticking to itself, not so much to your skin, but it'll stick to itself really well. I also carry typically like Gorilla tape, or
I was going to say, this is the part where I plug Gorilla or duct tape, because it's both flammable and it can be used as kindling, and it can help you with that.
100%. And then there's, they've advertised it on TV, but I can't think of the name of it off the top of my head. You see them like
the stuff where
slapping
they
it
wrap
on
the boat in it, and then they like sail
Yeah.
it with, and then they put the boat.
So I can't remember what that stuff is called, but I carry a little bit of that with me.
Okay.
Not so
Flex
much
Seal.
for.
It's called Flex Seal.
That's it. Yes, Flex
Yep.
Seal. So I carry that for cracked boats.
That's a great
'cause it
idea.
works really well for that. And people crack their boat all the time when you're kayaking. You come off
yes.
a drop, you know, hit a rock where you land too hard because you landed really flat, you know, and you split the tail of your boat up open or
Yeah.
something under the seat. Like it's really hard to paddle a boat when it's, you know, 3/4 of the way full of water. Makes life difficult. But
That would work for surfboards too, probably.
yeah, it probably would. But yeah, it works really well for the most part. I mean, at least
Okay.
for a run, it'll stay on.
Yeah, that's pretty cool. I never even thought about that. I'm always like so focused on what I know, which is duct tape and Gorilla Tape.
Yeah.
I did learn that the Gorilla Tape burns better. So if you're really looking for the kindling option, you want the Gorilla Tape, according
I
to
haven't
John
tried
Turner.
that. Okay.
Yep.
I normally go for like a little bit of lint or
Yeah, lint is good.
like
Dryer lint.
cotton, and I
Yep.
just push a bunch of Vaseline into it and let it, you know,
Yeah.
be fully soaked.
I also got myself just a pencil sharpener. And
Oh,
so
okay.
it's just a light little pencil sharpener. So I've thrown that in my kit now. So I can just make a lot of swirlies and make kindling pretty easy.
That's very smart. Yeah.
Yeah, I was pretty excited about that. That was one of those things. It's like, oh, okay. I bought one right away. Now, like if somebody dislocates their shoulder and we get it relocated, we're going to put them in a sling in the ER. Or I teach people how to fold their shirt up and like turn their shirt into a sling, but you can't really do that while you're in a kayak. So I liked what you said about tape.
Yeah, you know, in hindsight, it seems like a good idea, and that's probably what I would do now, if it happened. At the time, I didn't do that. I didn't think about it. He
Well,
did
that's how we learn.
fine,
We ruminate
but
about what happened and we come up with ways to do it better.
yeah. Yeah, I mean, like I said, he did fine for the rest of that run on the water, you know. But yeah, I think in retrospect, yeah, I probably would have taped across the shoulder. And not so much necessarily like that's not going to provide a ton of support, but it's more of a reminder to, you know, kind of protect it and kind of insulate it, you know.
Yeah. Yep. And then, so we talked a little bit about medical supplies and equipment that we'd recommend people have included in their first aid kits to be better prepared for this. We talked about the nuts or the pitons, which might help you create an anchor when you need to on like a rocky surface. Like there have been some
Yeah.
canyons that I've kayaked where like you're not stopping
Yeah, so like
unless you can use the rock.
not, you know, lots of trees here in the southeast, you know, so you
Yeah.
got a lot of, you know, mechanical advantage options. But yeah, if you're paddling out west, Colorado, California, you know, your options for something you can tie a rope to or connect to, you know, are pretty slim. Grand Canyon's a great example.
Yes.
I've paddled it, and you know, there's not a lot of foliage in certain parts. I mean, you're literally just looking at, you know, sand and boulders and maybe some steep, you know, steep kind of cliff or kind of ravine style kayaking. And you see a lot of that in kind of the, you know, the Northwest.
The piton thing that was brilliant. I thought that was a great idea. And so then some form of tape, either athletic tape, physio tape, duct tape, Gorilla Tape, Flex Seal. I wonder if you can put Flex Seal on the skin. That's
I think it'd be difficult to get off, but
yeah, I'll test that on myself before I recommend somebody else do that. And so anything else that you can think of that they should have in their kits to be better prepared for shoulder injuries?
yeah, I mean, you know, general safety stuff is always helpful. You know, I carry a short piece of webbing shoved in my life jacket. You know, it's maybe basically arm's length for me, so it's probably right under
piece.
6 feet. Yeah, I carry that, and I normally have two like auto locking carabiners like attached to it, and I just keep that shoved right in the front of my vest. And then, you know, always a throw rope. You should never get in a kayak without a throw rope.
Yes. Yep.
So that's handy to have. And between those 2, 3 things and your life vest, you're probably in decent shape. At least for that particular injury. Now my medical kit that I carry's got, a little more stuff in it. I've
Like a
got
Sam
some,
splint.
yeah, like a Sam splint. Yeah, I added that after I broke my wrist. Yeah, sure enough.
Yeah, I love the Sam
Nothing,
splits.
nothing like paddling 3 miles with a broken wrist and all you've got's a duct tape and an elbow pad taped around it. It's great.
Oh, it was better than nothing.
Yeah, better than nothing. Yeah, it's
But
manageable, but
oof,
yeah, a little more support,
yeah,
moldable support
yeah. The
is
Sam splints are
nice.
just clutch. I love them.
Yeah.
That's great. So
Um,
what's the craziest place? Like, have you ever been kayaking somewhere where you were like, I'm a little scared, more scared than I like to be right now? Like, have things ever been more intense than you expected them to be? And
um, yeah, so we were talking about like, stepping up, from like class 4 to class 5, and like paddling, different kinds of water. I spent a good like chunk of years like, kind of paddling class 3, class 4, and then spent a bunch of time like at the Golly paddling, which is technically class 5, but it's different than class 5 creeking. That's big river, big water. I think that kind of water's more forgiving if you
okay,
have a good roll anyway. Um, steep creeks like we have here in the southeast, like Coxaway or the Green. A lot of the stuff out in California that's super steep, um, less forgiving. It's shallow, it's fast running, it's swift, it's harder to get out of the water. You flip upside down, it's going to beat the snot out of you while you're upside down. So yeah, I've been on a couple runs where I've like either been a little rusty and probably shouldn't have been out there, or I've like been one of those days where I like made the mistake of getting on the river and just wasn't in the right like mental focus.
hmm
Yeah, I guess I've probably 2 instances, I guess, that I've kind of had like questionable, this was a bad decision moment. Um, I took a long swim on the Russell Fork, one of those kind of moments. I was having some questionable life stuff going on, and I was like, I'm gonna go paddle it. It'll get my mind off of it, and that is not what happened.
oh no,
Yeah, so yeah, there's nothing quite like coming up for air and thinking I'm still in the middle of this rapid and I'm not gonna get out soon, and you just get a breath. You don't even get like a full breath. You just get a like you exhale just enough and kind of suck in, and then you're back under. Um, but yeah, not great. And you get like you hear people that have almost drowned talk about, this moment of like utter calmness, like right
yep,
before you pass out. Um, it's actually pretty peaceful. I agree.
it
I've
is. Yep,
experienced it. It's very, very calm.
I
Um,
agree.
everything goes silent. Luckily, I
And you're like,
popped
it's
up.
okay.
Yeah, yeah, exactly. And you come to terms with the fact that you're about to die. Yeah. Um, Luckily, I popped up, right before I blacked out, and was able to jam my fist in between 2 rocks and do a fist
Wow.
jam like you do
Yeah.
rock climbing, and
Yes.
just hang out there because I had no energy to keep myself out of the water or swim anymore. Um, but yeah, not great. I guess that's the other thing I recommend people do is like, like there's nothing wrong with like running, but if you're gonna paddle class 5, like you probably should spend some time practicing your swimming.
Yeah.
I'm a decent swimmer, but I'm by no means the fastest swimmer. I can tread water a long time, but that's something after that happened that I realized I'm like, it's probably a component of your rescue capabilities that you need to work on.
Yeah, some power. Like you have to have some power in your swim in some of those instances.
Yeah,
like you can use the
100%.
water and the leverage, but
Yeah.
now
So,
what's your bucket list? Like do you have like, oh, someday I'm gonna go there and I'm gonna paddle that? Like, do you
yeah,
have a couple of places on your bucket list?
there's some stuff that like I have like every once in a while I think about and I'm like, yeah, I'd like to go do that. But then I like, I'm not quite as I guess adventurous as maybe I once was.
I think it's
I don't
called
know. I think
wisdom at some point.
yeah, I guess.
Yeah.
I think I don't know. I guess, you spend enough time in medicine, I think it kind of like also makes you, take a little pause at, doing things that maybe aren't the brightest idea.
We're constantly faced
Um,
with all the different ways you can get hurt.
yeah,
Yeah.
100%, 100%.
And how
Like,
unfortunate that is, life-changing.
but yeah, I guess like runs that I have thought about doing that I still kind of think about. I think at some point, if I have the free time, like the Stikine is probably on my list of things I'd like to
What's it
do.
called?
The Stikine,
Where is it?
it's Alaska area, I believe.
Oh, that's cool.
Um, and then the Moose in New York looks like a pretty cool run. From different things I've seen and heard, it's got nice, class 5 moves on it. And then I'd like to spend some time in South America too. Um,
Yeah,
I
Costa
don't have any
Rica was
specific
incredible.
runs in general, but
Right now the name of the river is escaping me, but Costa Rica was incredible. Like there was a standing wave on this river where like you could surf for hours.
yeah.
It
But
was
yeah,
pretty
there's a
cool.
lot of good stuff down there. And then there's I know a couple folks that I think they do is it Adventures Outdoor. I might be misremembering that. But they run kind of like a kayaking and like adventure company out
Oh,
of
cool.
I think they Ecuador, I think.
Okay.
Um, but so, there's a lot of good stuff down there that I'd like to see. And it's
Yeah.
convenient that when it's really cold here, that's when they have good whitewater there. So, nice
It's a
trip
good
over
escape.
like right after Christmas or something like that.
That
I
sounds
mean, I don't
awesome.
mind paddling in the cold. I kind of like it. It's pretty, especially if it's snowing. It's really
Yeah.
nice, but
The dry suits are a little cumbersome.
for in what way?
Well, I think it just always feels like more. Like in a wetsuit, it feels like it's just like a little bit more of your skin.
Oh,
But in a dry suit, it's like you're
yeah, they don't. Yeah, the fitting isn't like awesome. They're always like baggy in kind of the not right
in weird places.
areas.
Yeah.
Yeah,
And
yeah.
then like it's like squeezing your neck and then
Yes, and it
squeezing your
does. Yeah, they
wrist.
very much squeeze your neck. Yeah, that's
Yeah,
something you have to get used to. That when
you
I first
do.
started wearing them, I was like, I don't love this. Like
I
it's
don't
like
love it. I
pushing
don't
right
love it.
here.
Uh-uh.
Yeah.
Like I don't even
Yep,
have
that's totally true.
claustrophobia, but yeah, I'm always like if it requires a dry suit, I'm like I need to think about it. We need to do a risk benefit analysis here on
Yeah.
my
There
discomfort.
are there are advantages though, right? Like the nice thing about it is like uh when I was working different jobs and was, in a colder environment, I'd
Mhm.
get off work, hop in, to the car, drive to the put-in, throw all my gear on in my work clothes, like
Fair.
tie,
Yes,
dress
that's true.
shirt,
That's true.
get on the river, paddle, get off the river, take it off. I'm like, we're ready to go to dinner. Like,
And you're still dressed in your
yeah,
dry.
you're still
That's
in the
awesome.
clothes that you went to work in. Yeah.
Oh my God, I love that.
Um,
What'd you do after work? Well, I kayaked class 5 rapids.
yeah.
No big
So,
deal.
but
No
yeah, so
biggie.
advantages to the dry suit. I do like that.
And so any advice that you would have for our young listeners, young medics who are early in their career, thinking about going to medical school or thinking about trying to become a better kayaker?
Oh, the medical school thing's a tough one. I will give anybody the same advice that I was given by a good friend. If there's anything else you could imagine doing that will bring you joy, you should go try that thing.
That's what people tell musicians.
Yeah, and see if that will bring you enough joy that you'll be satisfied in your life.
Yeah.
If you try that and it doesn't work, then medicine's probably a good option because it is a lot of sacrifice,
It is. It's a lot
It
of
really is.
sacrifice. Gosh, it's
Not to
so
say
fun
that
though.
not to say that it's not rewarding,
Yeah.
but there are a lot of silent tears and emotional turmoil, I think, that you go through when you sign up to do this as a career.
Yeah.
Um,
Oh, my tears were not silent. Everybody knew. It was painful, but it was worth it. It was
yeah,
worth it.
but so I think, from medicine standpoint, that's what I would say.
Now, how about kayaking? Like, is it best to contact a guide outfit and say, "Hey, I'm new, teach me how to do this"?
So I personally have never signed up with a course. Not to say that you shouldn't. I've had some friends that have done that and said that they loved it and they learned a lot. I've, I've been lucky, I guess, since 2013 to have lived in an area where there was a pretty large community for whitewater kayaking. The Bluegrass Whitewater Association in Lexington, Kentucky. I lived there for about 5 years. So big group, lots of folks that are interested in like getting you involved, and people at different experience levels that you can kind of pick things up from. So I started out first, I don't know, year basically just like muddling my way through. And watching other people.
Like, what was the
Once
first day like?
Oh, it was a mess. My first day, my buddy had bought a whitewater kayak and he grew up on a lake. So he, had paddled his whole life, different things. Um, this is when I guess I was living in Murray, Kentucky at that time. And so he's like, oh, let's just go out and try this. Admitted this was like February or something. It was cold, very
Freezing.
cold.
Yeah.
But the air temperature was warm, warm enough anyway. So he put me in this little like Jackson playboat, like 5 foot long. He's like, "Ah, you'll be fine. Like, just try it out, see what you think." And I managed to sit down in it and take like 3 strokes, and then flipped upside down in like 30-degree water.
Oh, brutal.
So that was my first experience with whitewater, and then I was like, I don't know about this. So I don't know. So I wound up moving to Lexington after that, and like I said, my buddy Evan at the time got a little more involved in it, and I remember that experience, and I was like, well, maybe I've seen other people do this, and that didn't happen to them. Maybe there's something I can learn here to get better at this. So I just started working with people, went to some role sessions,
Nice.
watched some videos online. And then there's a nice little like kind of low grade class 2 stretch of whitewater called the Elkhorn, there outside of Lexington, Kentucky, and Frankfort, Kentucky, and spent I don't know, maybe 6 months or a year, when I had free time, intermittently just going out, maybe once a month or twice a month or something, and just kind of piddling around on it, trying to get better. Um, Once I figured out how to roll, which is one of the first things you should learn how to do if you're gonna
Yeah.
do whitewater kayaking.
It's the first thing I learned.
Yeah, learn how to do that. It will make your life a lot easier.
Yeah.
So yeah, once I learned how to do that, I had some friends that were, figured out that I had like a really good roll. So they're like, oh, we're gonna go down to like the pigeon. I was still kind of like not a very good paddler. And the pigeon's like class 3, like kind of low grade class 3. And so I like went and did fine, but like I flipped like in every rap, you know.
Oh.
It's fine, it's pretty deep, just kind of low risk. And so we went back, I think that summer and did that like maybe 2 or 3 more times. I can't remember. And somebody was like, "Oh, we're going to the Ocoee this coming weekend." And I kind of looked that up because I didn't know what it was. I was like, I've heard people talk about the Ocoee, but I don't know anything about it. And I read about it and I was like, oh, this seems drastically more difficult
Yeah.
than the pigeon that I've only done 2 or 3 times now. So I let one of the guys talk me into it. He's like, "Oh, you'll be fine. You got a great roll. No worries. You won't have any issues." And so we went and I did it and I flipped in basically every rapid again.
Oh no.
And it's, for the most part, like the Ocoee's a relatively safe river if you stay in your boat and, avoid the 2 or 3 places that are shallow.
Yeah.
But I had kind of a rough go in one of those spots and injured my shoulder, flipped upside down in the rapid. I think it's broken nose. So I was hurt for a little while. Not like I needed surgery or anything, but just, had some soft tissue injuries.
A broken nose.
Yeah, I mean, I took a good whack, like right across here. Well, it wasn't bad enough that it deterred me. So I just kept, I kept going back, and kept working with other people. I'd see somebody else and watch them and be like, oh, like they've got good technique. Like, let me go talk to them and like see what they're doing. And so that's kind of, the progression. But yeah, I think, taking a course isn't a bad idea. Just to get the fundamentals down. And there's different levels, you can sign up for somebody that's just gonna, teach you how to get in your boat and what a paddle is, and then you can go out, and with somebody who's a professional that, races, and let them, teach you how to run class 5 or how you should think about running class 5. But yeah, so I don't know. I guess I was addicted after I, took 3 strokes and swam in 30-degree water.
Like, this is great. I'm gonna do this.
Yeah. I mean, it's so peaceful, right? And it's something that most people never get to see, like, you get in a deep canyon in the middle of nowhere with like you and 2 or 3 of your friends, like
sloths, toucans, like
yeah, there's nothing quite like it,
that's true. So I know we both struggle with this, but do you have any advice for how people balance their love of the outdoors and their career?
It's a tough one. I think sadly, you either one have to be very, very motivated to kind of, maybe you cut your sleep short now and then to get out and get things done. So that's an option. It's not a great option. But if that's if the sport's the thing that like gives you joy to get up and kind of recharge, I think that's reasonable. I still do that occasionally, not as much as I used to. I find that sleep's a little more important to me these days.
Sleep is important.
Yeah. But there was a time when I would do that, you work 5 or 6 days in a row and then drive 3 hours to kayak for 3 hours and then drive back 3 hours, on your day off.
Mhm.
So I do that a little less frequently. But I think the other thing, right, it's like pick the one thing that gives you the most joy. Um, I
Yeah.
kayak, I rock climb, I used to mountain bike a fair amount. So I do the mountain biking a little less. I have other reasons for why I do it a little less. It mostly has to do with um, friends that have had significant hand injuries because of mountain
Yeah.
biking. So I've
And
kind of,
head.
yeah, kind of dialed that one
I
back a little bit. You need your hands to function as a doctor.
yeah.
Um, but yeah, so I think, choose the sport that, gives you the most joy. Um, and hopefully it's, relatively close to your location, so that you don't have to, drive super far or hop on a plane.
Yeah. It's like if you're sad because skiing's your thing and you never get to ski, well, find a way to move your job to a mountain town.
Yeah, 100%.
And if you want to be able to kayak, find a way to move your job. They need every sort of job is needed everywhere. And with the advent of remote working, people can live all over the place.
Yeah, so I think those are good choices. That's kind of my thoughts,
Yeah.
about how to make that balance.
That's
And use
great.
your
I love that.
vacation time. Don't
Use your
let it go to
vacation time
waste.
wisely. Yes.
Yeah.
Yes. And I've managed to turn some of my love of work in the outdoors into part of my career. So that
Yeah.
if anyone
Yeah,
can do
you're
that, like
doing
that's the that's the holy grail right there. It's
yeah,
just so
you're doing a great
fulfilling.
job with that. Yeah. So
Thank you.
I haven't
Robert, I
quite
can't
figured
thank
that
you
one
enough.
out yet.
We will. We will.
Yeah.
Promise. We will. And thank you again. I just really appreciate you taking time. I know how busy you are. I know how long hours you work, and I just really appreciate you taking time out to talk to me and to talk to our people and help educate them on ways that they can kind of help keep them safe and how they can mitigate certain injuries while kayaking in the wilderness.
Yeah. Happy to.
Any parting words of advice?
Stay dry.
Stay dry. Nice. Stay dry. All right, folks, thank you again for joining us on the World Extreme Medicine podcast. I'm Dr. Sarah Spelsberg. And if you're listening, you too are an extreme medic, and we welcome you to the World Extreme Medicine family. Special thanks to my friend and colleague, Dr. Robert Knopp, for his insights on how to manage shoulder dislocations in the wild. And see you next time, and hopefully see you at our annual conference in Edinburgh, Scotland. Bye, folks.
Thanks for listening to the episode. Please feel free to rate, review, and subscribe on whichever platform you're listening to. Please also head over to the World Extreme Medicine website, where you can find more engaging content on extreme medicine webinars and indeed the collection of courses from our global network, including humanitarian, disaster relief, expedition, space, military, tactical, and performance medicine. Thanks again.